So welcome to the Kane Education YouTube channel. In this video we'll discuss about the legal implications in nursing, right? So what are the legal implications, and in the previous video we discussed about the code of ethics, right? So introduction. So in the introduction, what it is, the why the law is important in nursing, and what is the meaning of legal implication, right? So it defines the legal boundaries there for the nursing practice. So they should not enter, they should not cross that boundary and to treat like a doctor, and they should not neglect the duty and treat, being like a slave person or being like a patient in the ward. Okay, they should have some boundaries, and they have some responsibility, and they have some confidentiality, and they have some laws, and within that boundary, within that legal boundaries, they have to follow all the nursing practices. That should not be exceeded, that should not be violated, and that should not be neglected. Okay, so these are the thing that defines about the legal implications, right? So that will protect from the liability. What are the liability, what that may pay or that may compensate, that will I will tell you later. Okay, what about the client's rights? And if you are not agreeing about, or if you are not considering the client's right, and if you are not ensuring the nursing actions, so that will be illegal. And if you are agreeing, and if you are ensuring, and if you are considering the client's right, and if you're considering the liability, these things, what we can say, considering all these will be said as the legal boundary illegal implications, right? So law and its functions in nursing, the sum total rules and regulations that is governing the society. Okay, so that is law. So what are the legal terminologies we can see in the legal implications? First and foremost, very important, crime. What is the crime? So it is wrong committed against the person or a patient or a patient's property or a public good, including includes intent to do wrong. That is, this is intentional. Okay, so if it is intentional, then it is said to be crime. Clear? So what are the types of crime, sir? So first one is a misdemeanor. Misdemeanor, it is a less serious than the punishment. Okay, less serious than the felony, sorry, less serious than the felony. Sir, what they will give the punishment for the misdemeanor? They will make the fine, or they will make the imprisonment less than 1 year. Okay, less than or equal to 1 year. Okay, so they may make fine and also less than 1 year imprisonment, both also. Clear? Sir, what is the felony? It is a serious crime. Okay, it is a serious crime where the punishment imprisonment is more than 1 year. Less than 1 year or equal to 1 year is misdemeanor, whereas felony means it is more than 1 year. Okay, so felony is a US law, whereas in the this one, in the Indian, we can say that is criminal law itself. Okay, yes. Next, it's a serious crime where the punishment is more than 1 year, and health workers may be convicted for what are the felony things will occurs for the for the imprisonment of health workers. So that is falsification of the medical records, such as life-saving medicines we have given, or narcotics for the pain relief, so we have given like that. Something else they have written wrongly, and they have been sold out outside of the hospital from the government hospitals. That's a falsification medical records they show. So that is also felony. Okay, that is also serious crime itself. Okay, insurance for fraud. Okay, that is also felony. Theft of narcotics from the hospital, that is also felony, because narcotics should not be allowed legally, right? So practicing without license. So if you are not doctor, and you are being a BS nursing, and you are telling to everyone, I have completed MBBS without certificate, and or else if you are being a registered nurse without your KNC, okay, that time also it is practicing without license is illegal. Clear? Okay, that is felony. Are you understanding? In that illegal, which one? Felony it will come. It is one of the serious crime, right? Okay. Next, sir, what is liability? It's a responsibility. Okay, it's a responsibility to pay or compensate for the injury or a loss that you have made. So why it is happened? That is due to the negligence. So wrong action has been done, or the instead of giving the peptides you're giving zone, or instead of making the legal abortion by a medical termination of pregnancy, so you have done the illegal abortion. So participation in euthanasia, that is active, or we can say that is active euthanasia, or we can say that is assisted. Still it is in controversial, as I said. Active or assisted euthanasia, if you are participating in it, that is also liability, and you are not compensating for it. Okay, so you are not compensate or paying for the loss of the parents or guardians of the patient. Okay, so omission, failure to act. Okay, failure to act, that means if you are not providing the medications at the prescribed time and the prescribed medication. Okay, so that is omission, failure to act. So failure to perform the treatment, you can't compensate. Failure to report the child or elder abuse, you can't compensate. That is you can't compensate also, you can't pay that one also. Okay, that is failure to report communicable disease. So that is, these are all what we can say, these are all liabilities. Okay, that is due to the very important negligence. Clear? So this is only for your understanding purpose, not that much important. Next, coming for the tort. In the tort, violation of the civil law. Okay, violation of civil law. So wrong against an individual, where we can see the intentionally and unintentionally. Intentionally we have five categories, that is assault, battery, false imprisonment, invasion of privacy, one's privacy, or making characterless, that is defamation. Okay, that is defamation, right? So in the defamation, written, if it is there, that is written defamation, libel. Or by the spoken word defamation is there, that is slander. Okay, unintentional, without knowing itself, you are not reading the risk, and you have administered, that is negligence. And if you are administered, you are administered after reading the risk also, you are administered, and that will leads to the problematic or life threatening situation, or a harm to the patient. That time we can say that is malpractice. Sir, what if it is problem or harm is not occurred after the reading the risk also? Then it is negligence itself. Clear? Before reading or after reading, if there is no harm, if there is a harm. Okay, if there is a harm before before that, means if he is not reading for any risk, previous risk, and he administered as it is, that is negligence. And uh, after reading the risk also, if he administered and there is no harm, that is also negligence, right? Okay, so next, assault. We'll see one by one. So threat or attempt to cause bodily harm, that means, so they are telling, that means the nurse, okay, the arrogant nurse, they will tell you, I will kill you, or uh, mm, i will um, I will slap you, like anything. Okay, if they are telling like that, like this, only they are attempting, so only they are raising the hands, but they are not contact, they are not making the physical contact, only verbally they are doing it, then it is called assault. Threatening or attempting to bodily harm, but not physically, only acting, that may do, that they do, and they will do the verbally shaming, verbally they are making threat, that is assault. Clear? So do you understood the assault? What is battery? If they are contact, okay, physically they are contacting, without with or without assault, okay, that is battery. With or without assault means what? Even though they may tell you with very angry, if they are telling with very angry, if they touch, if they touch that is also battery with touch without consent, very important. Without consent, okay, without consent, if they are touching with angry, that is also battery. Or without angry, they are touching without consent, that is also battery. But however, the touching without consent is battery, with angry or without angry, okay, that is battery, right? Touching the body or cloth, chair, bed, give injection against the patient's will, okay. Giving the injection to the injection for the patient, you should ask the consent whether I need to give or not, because the treatment is the option, decision choice of the patient itself, that's a rights, okay. If you are violating that right of decision making, and you given the injection without patient's will or without patient's consent, then it is also a battery, okay. Battery means legal implication. So false imprisonment, suppose if I say, if the patient is so much violent, okay, if the patient is so much violent, we will give the 4 point restraint. What is this 4 point restraint means? So 4 point restraint means this is the, okay, so the patient on the bed, we will so tie up all the four limbs. So this is the 4 point restraint, where if the patient is violent, so that we need to do the anger adult, okay. So if the violent or aggressive patient, if it is there, 4 hour is the what we can say, that is we have to take the order, okay, order from the physician. Only renew order renewal, we have 4 hour, we need to keep them restraint. Only when the patient is so much violent or self harm or harm to others, that time we can make him restraint only for 4 hours. Afterwards, we need to again renew the order means we need to ask the physician order. Later on, we need to consider 4 hours for the adults, okay. Next, so unlawful detention without legal authority, okay. Suppose if the patient is not violent, and if you are restraining him, okay, if you are restraining him, then it is false imprisonment, and you are not imprisoning for a particular reason. You are imprisoning means you are not leaving him independent, that is imprisonment, okay. Imprisonment what? Not leaving independent, that itself what? Imprisonment. So what is the false imprisonment means? For not leaving the independent, you have given the false assurance or false reason for it. So it is a unlawful detention without a legal authority. Patient must not be restrained against the will, clear. And if you are doing it, that is false imprisonment, clear. Patient must not be restrained against the will, but still you are doing it, then it is false imprisonment, okay. And without legal authority, that means if the patient says I want to go out, and you are locking the door, and you are not let him go out, or if you are tying the patient without any the stay without any the formal consideration, without any asking the physician, then it is said to be false imprisonment, clear, okay. Invasion of privacy, somewhat the patient has disclosed to you, and that you should not talk in front of any others in presence of the patient, or in absence of the patient you should not talk, that is you should not talk, and you should not tell to everyone. So invasion of privacy means you should not include any personal information, okay. So that is, so in Kannada we can say ಮೂಗ್ ತೋರಿಸಬಾರ್ದು, ಅಥವಾ we should not say, we should ಹಾಕ್ಕೊಡ್ಬಾರ್ದು, okay. We should not tell to anyone. So that is invasion of privacy, right? So this is where the positive ethical principle is confidentiality, isn't it? Confidentiality and fidelity also comes, isn't it? So fidelity is a trustworthy, confidentiality where they can keep the secret themselves, that is confidentiality. If they are violating these rules, if they are violating, and if they are not following the confidentiality or fidelity, that time that will lead to the invasion of privacy, and they are so much interested in patients personal information, and they are telling they may tell improper also, they may tell proper also. The disclosure of personal information, so that is invasion of privacy, right? So violation of rights to be left alone. Improper disclosure of personal information does not depend on whether the information is true. Okay, so it may be the true information or it may be the false information, so they will disclose improperly, right? That is invasion of privacy. Next, defamation. Sir, what is the meaning of defamation then? So defamation is a false communication, the damaging the reputation. Okay, that may be written or printed, or that may be spoken words. So spoken words, if it is there, then it will be said as that type of defamation will be called as slander. Or if that is a written form, then it is called libel. Please do remember, labile is different, libel is different. Okay, so example as I given here. So example is, so a newspaper falsely publishes that a nurse stole hospital drug and damaging her reputation. So damaging her reputation by telling the false statement about the stealing of the hospital drugs. Okay, so that has been published in the newspaper, right? So that is written form or a printed form. It is called defamation. So libel, defamation, right? Okay, what is slander defamation? Against him, if you are talking like, if you are telling to somebody that nurse is not doing well, so and he was incompetent, he can't able to hold the syringe itself, something else, you are defaming the nurse, and the patient uh, got got what we can say, the patient is not trust to the nurse. Okay, that time it will be said as slander. Okay, slander means what? False preaching or false telling to the patient or a healthcare provider about the nurse is incompetent, like that. If they are telling, that is slander. Okay, so next, coming to the unintentional thoughts. Up to here we discussed about the intentional thoughts. So these are intentional. Slander is also intentional, libel also intentional, invasion of privacy intentional, false imprisonment bekanta, so that was doing intentionally. Battery, intentionally they are touching the physical contact, they are actually doing. Assault, intentionally they are threatening the patient or other person. That is, all these things are intentional tort, what we can say, intentional torts. Assault, battery, false imprisonment, invasion of privacy. In the defamation we did libel and slander. Now we will get into the intentional unintentional tort, in that negligence and malpractice. Okay, yes. Negligence, what is the meaning of negligence? Here, the harm caused due to failure to perform the duty. Okay, not by attending calls, it is failure to perform the duty. Not following the standard precautions. Okay, they are not making the hand hygiene, and every time they are doing the procedure without hand hygiene and washing, then it is unintentional tort, or we can say that is negligence. Clear? So performing the unlearned procedure, they don't know how to do the procedure of catheterization, and they are doing it, so and leads to the STI. So that is performing the, so STI, sorry, the performing these things, and that will get to genital problems. Okay, so next, failure to report the faulty equipments. Okay, so if the a BP apparatus is not working, or if the sphygmomanometer, sorry, if the vital monitor is not working properly, or so the spirometry is not working properly and they are not reporting it, nebulizer is not working properly and they are not reporting it. So whatever the faulty equipment is there, they are not reporting it, and failure to report, that's what we call negligence. Failure to prevent the injury, they know if we are not raising the cell rails, 100% the patient will fall from the bed, they know, but still they are not raising the side rails. So thereby afterwards patient is already in a restless, and they may fall. Due to that, injury occurred. So failure to prevent injury. Okay, that is negligence. Not questioning about the incorrect doctor's order. Okay, order as given by the doctor, so gave this medicine and it was known, well known by the nurse, and she was not asking about it, why the doctor has prescribed these things. So instead of giving the what we can say, the rabies vaccine, they give an hepatitis vaccine though. So you need to ask the healthcare worker why it is a health hepatitis vaccine has given. So like that, somewhat you should question them, right? So I'm just giving the example. And if you are not asking, that is also negligence. Just you should not do what the doctor says, you should question also. If it is if you are not asking the questions, that time what happens, the doctors may tell you that you should ask. You have never asked me whether I should give or not, like that you didn't ask me, so they may raise this incident against you. Okay, that is also negligence, right? Okay. The malpractice, sir, what is the malpractice? We know that professional negligence, it's a improper, injurious, faulty treatment by a nurse. So suppose if the patient is having the paracetamol, uh, okay, so penicillamine, I will tell you pencil. Okay, penicillamine injection. So you didn't check for the allergy, you are not checking for the allergy. If you are checking for the allergy, that one will be said as non-maleficiency. If you are checking for the risk, non-maleficiency. And if you are not checking, okay, if you are not checking the allergy, if you are not checking the allergy, then it is